Hi, you'll have to excuse my parrot. She thinks she's a cat or a bird. She likes to either lay on me, but if I have my computer on my lap, she can't lay on me, so she gets as close as she can to me. I'm doing a post real quick because I wanted to let everybody know that we have officially adopted our embryos, and we are looking to implant them on August 28th of this year in 60 days. I think it's actually 61, but I don't usually count the day of or the day that I'm in. So it's, I think, 60. So we've adopted 4 embryos. We're super excited. We're going to implant 2, and we're hoping they stick and they stay and it works. We, my husband and I, um, have been saving again, and it cost us a lot, but we managed to pull the funds together, and over the month of July we'll be buying my medication. The big thing that the clinic said that I will be doing is taking birth control to shut down my ovaries. Um, and I'll only be taking active birth control, which is the first 3 weeks, and then I'll go into the next pack of active birth control. She said, the nurse that we talked to said that I shouldn't have a period, and if I do, it'll be just a little bit of spotting. And then I'll start Lupron and eventually progesterone. Um, I was going to do the quinone gel. I think that's how to pronounce it. But I'd read a lot about it causing uterine cramping and discharge, and it clumps up and it's nasty and gnarly. And I asked her if there was another option, and she said I can do the progesterone shots, and should the pregnancy stick, I can do the progesterone shots all the way up to week 10. I just I've always had issues with my uterus and cramping, and I want to give them the best chance, and I don't want to add irritation. So, and at the same time, believe it or not, we found out that the progesterone shot, doing the shot way, is actually cheaper because they can compound it, and I'll only have to do 1 shot a day, whereas I'd have to do two, uh, 2 tubes of the quinone gel. And they're actually $15 a piece, which means it would be $30 a pop. So just a little bit of information out there. Um, so that's really not a lot of medication. It's not a whole lot of stuff going on. She said that we can actually use more birth control and do less Lupron, so it's cheaper. And I'll only have 2 appointments for ultrasound and blood work prior to the embryo transfer. So less time I'm out of work, which is really, really great. Um, so excited about that. So basically 3 appointments, and I'll have my transfer done on the 28th, which is Friday, and I'll rest Friday, Saturday, Sunday, and go back to work on Monday. And then it's the dreaded 2 week wait, which I know we all hate. I especially hate the 2 week wait. Um, right now I don't know if you can really tell because I look really rough today. Yeah. I have lost like 20 more pounds. I've been working with a doctor, doing some supplements, and reassessing my diet, and I've lost more weight. So I'm actually below. Most doctors require you to be a certain BMI for IVF, though my current doctor doesn't require it. I did it for myself to make sure that the babies had a better chance. I say babies because I'm kind of hoping for twins. It would be great. One is fine though. We're happy with whatever we get. Um, so I was hitting a plateau after losing all the weight with the lap band. It being 2 years roughly since I'd had it, and I had gotten down about 115, 120 pounds, and I've now lost another 20. So I weigh about 230 pounds, which is really good for me. I've always been really overweight. My goal, though, is since I don't really start the medication, the Lupron, and all that until August, I'm gonna go ahead and continue the supplements till the end of July. My goal is 5 to 10 more pounds, If I can lose more, that would be great. I'm trying to work out, though my workouts have kind of been stunted a little bit. I developed a blister on my stub, and it eventually popped, and unfortunately it was right over the scar, and when the skin tore off, I have like a sore about that big on the distal end of my stub, and it's kind of painful, and I don't want to get an infection, so I'm trying to take it slow, and hence the reason I look like this. I'm just kind of relaxing, taking it easy. I'm doing a little bit of yoga, light yoga, and some stretches, but nothing like I was doing. I'm not going for my long walks or my runs. Tomorrow I'm going to go swimming, uh, which shouldn't hurt the sore at all. The chlorine shouldn't bother it. Um, and I'm eating clean, meaning we're staying away from processed foods for the next 2 months while we're getting ready for this. I've been doing this since the lap band, so my eating has been better. But like we're doing like salads and more organic stuff, less fatty proteins. We're sticking mainly with fish and chicken and a little bit of turkey. I've kind of stopped eating pork just to get healthier. So we've made some changes preparing for it, and um, I've seen the upside of that is the weight loss. And what we figured is whether or not I get pregnant, we'd like to continue the clean eating, because the more organic we go, we notice the better that we feel. And I say we, my husband too, because he's diabetic, and we his health is important to me. He'll be 50 soon, and I'd like him to be able to watch our children grow up. So anyways, we're really happy. We're really excited. All the pain and heartache and frustrations and uh, aggravation that we went through have paid off, and everything has come through, and it has been a real blessing. And now we're just kind of working towards the medications, paying for them over the next month, and getting ready. The doctor that I spoke with, or the nurse, suggested that I go ahead and start taking a prenatal vitamin. And again, by posting this, I'm just hoping that by, explaining to you the difference between the quinone gel and the progesterone shot, if this is an option for you through your clinic, it saves you money, and it's less irritation and all that stuff going on in there, which is already nasty enough. So, it's nice. Anyways, I'm going to stop for now and go back to resting and just kind of chilling. I'm crocheting some stuff today, doing a little bit of needlepoint, and relaxing because it's my day off and that's what I should be doing. So I will see you all around, and I hope everybody is doing well. See you soon.